Hello and welcome to It's Your Case presented by VetCT. My name is Stephen Tsai. I am one of the radiologists that works for VetCT. So on to our case here. This is a case of a rabbit with nasolacrimal disease. So we have a 2-year, 4-month-old spayed Netherland dwarf rabbit who has a history of chronic dacryocystitis, which is non-responsive to topical treatment. We have a cone beam CT of the head, which we're going to evaluate now. All right, so here we have a cone beam CT of the head of our rabbit with chronic dacryocystitis. And as is typical with rabbits, it's hard to get them straight, and so we can see that we're a little bit off center here. So what I'm going to do is I'm going to bring up our multiplanar reconstruction tool so we can straighten everything out and I can show you exactly what's going on. All right, so now we've got our rabbit in 3 planes. We have a sagittal on the left, axial in the center, and then a dorsal plane on the right here. The patient's right side is going to be on the left side of the screen, which is standard radiographic projections. So here we have the nasolacrimal ducts. They are in the nasal cavities. This is the nasolacrimal duct on the right side. This is the nasolacrimal duct on the left side. You can see that it is significantly larger on the left than it is on the right. And I'm going to show you what the nasolacrimal duct looks like in its sort of normal plane here. So we can see on this dorsal plane reconstruction here, running along the lateral aspect of the nasal cavity is the normal nasolacrimal duct on the right side, and then on the left side we can see that it's quite dilated. Over here, this is again the normal nasolacrimal duct on the right side. So here we can see the nasolacrimal duct, and notice where it comes in here very close to the tip of the reserve crown of the maxillary incisor. That's tooth 101. And then back here, we can see how close it comes to the reserve crown of the maxillary premolars. This is tooth 106. This is 107 over here. So these are going to be the most commonly affected teeth that cause nasolacrimal disease. Now, I'm going to go back into a straight view of the teeth. And so we can see that here we have the reserve crown of the left maxillary incisor. This is tooth 201, and you can see how it is dorsally displaced compared to the reserve crown of the opposite incisor. And we see all of this soft tissue thickening around it, which is consistent with a tooth root abscess affecting that reserve crown. And you can see that right here, this is where that nasolacrimal duct is being affected by this tooth root abscess. And it's pretty dilated all the way back. And then here you can kind of see where that reserve crown of the first premolar can also affect the nasolacrimal duct. Now, in this case, they also did a dacryocysto-rhinography. So essentially, you can cannulate the medial canthus of the orbit and infuse about 0.5 to 1 milliliter of contrast agent into the nasolacrimal duct in order to establish whether there is patency, or if not, whether there is an obstruction at a particular level. So we have that here on the right side of the screen, and again, I am going to bring up our 3D reconstruction here, our multiplanar reconstruction. Now, once again, we can see our nasolacrimal ducts here on the right side and then here on the left. This is after the dacryocystography. So there's positive contrast media within this dilated nasolacrimal duct. And as we go rostrally, we can see that that contrast stops abruptly right at the level of this tooth root abscess. And we can see that also on a sagittal plane reconstruction over here. So this is the contrast within the nasolacrimal duct, and we can see that right at the level of this tooth root abscess, the contrast abruptly stops. And that is consistent with a left-sided nasolacrimal duct obstruction secondary to a tooth root abscess associated with the left maxillary first incisor, or tooth 201. All right, so now let's talk a little bit more in depth about nasolacrimal disease in rabbits, and especially the imaging findings. So this is an image from a study done by Fritz et al. Looking at the normal anatomy of the nasolacrimal duct in rabbits as seen on CT, and then with a description of the procedure for performing dacryocystography, which we'll also get into. So the normal nasolacrimal duct has got two bends. So one of the bends here is at the level of the maxillary incisor, and then another bend here is more caudal, and it occurs at the level of the premolar reserve crowns. So the incisors that are right next to the nasolacrimal duct here are 101 and 201, the first incisors. And then it's the first two cheek teeth on either side. So 106, 107, 206, 207. Those are going to be the reserve crowns that will affect the maxillary bend of the reserve crown of the nasolacrimal duct. And this is the procedure for performing the dacryocystography. So you can use a 26 gauge catheter or cannula and use some diluted contrast. It kind of depends on the concentration of the contrast agent you use. But in this study, they described using 300 milligrams of iodine iohexol and then diluting that with an equal volume of saline. You prime your cannula or catheter with your dilute contrast, and then you cannulate the medial punctus with about 10 millimeters, about a centimeter or so of your catheter, and then you infuse 0.5 to 1.0 mils of contrast, either until you see the contrast coming out the nose or until it sort of is flushing back out at you. Then you repeat your CT scan, and those are the images that you saw in our case. And so in summary, the key points for diagnosing nasolacrimal disease in rabbits on CT, usually your nasolacrimal ducts are quite easily visible on CT. The most common cause of dacryocystitis is going to be dental disease, and usually it's going to be the reserve crowns of your maxillary incisors or premolars that are right up next to the nasolacrimal duct. So you get abscessation of those tooth roots, and your nasolacrimal ducts may be in the way. And dacryocystography is quite useful for identifying the actual level of obstruction of the duct. Thanks for listening. This has been It's Your Case, presented by VetCT, and I hope you have a nice day.